Hi all, I am Dr. Hirennappa B. Udnur, pulmonologist practicing at Sakar Nagar, Inspire Specialty Clinic, Bangalore. How do you differentiate between flu and COVID? Most of the time we treat it like syndrome. Earlier flu we used to see it is self-limiting. We will see for first 48 to 72 hours how exactly the tempo of a disease go. If he is young patients, he doesn't have any comorbidities, non-obese patients and doesn't have a risk factors like diabetes, hypertension, previous cancer survivor or anything, those risk factors are not reasonably young and vaccinated or unvaccinated, most of the time with first 48 hours they may get high grade of fevers with chills and rigors. That time you take paracetamol and they can manage with symptomatic medications. The fever goes off, most of the time it settles without any medications. Very rarely it may persist for more than 48 to 72 hours and the fever is ongoing. Sometimes it can go with the BP going low and they may come with the syncopal attack, they may feel giddy, excessive sweating, asthenia, dehydrations, those patients who require hospitalization. And these are the patients who have hypoxia, borderline saturations and who require admissions, especially the severe illness patients. We test for flu, which is throat swab, like H1N1 throat swab. We do the testing for these kind of patients who require hospitalization and we treat accordingly, because these medications which are started within 5 days of viral illness, they definitely have a good cure and they can prevent the complications. Oseltamivir is the drug of the choice. So this presentation is very similar and we will not be able to differentiate with the X-ray or clinical syndrome or also similar presentation. But COVID, sometimes we didn't know much about the COVID, and COVID is more dangerous than the flu and it has varied manifestations. So we do the throat swab plus rapid antigen test is available for COVID. We can do the both H1N1 and rapid antigen test. Sometimes RT-PCR is also used and they help to differentiate it. And recent past we are seeing both flu and COVID, both are being affected in a same individual. Sometimes dengue and COVID also we have seen which is being affected. So doing the test only will help to differentiate. Sometimes they are point of care testings with antigen testing, sometimes they are advanced testing with PCR which may require 12 to 24 hours. There is something called as TrueNat, it may take 6 to 8 hours. Sometimes this emergent decision making they have to take up for surgery because we need isolation facility, we need the use certain preventive gadgets to prevent ourselves being infected, and cross infections has to be prevented. So it is definitely important to differentiate between COVID and flu, and that can be done by good PCR based testing. Thank you.